10 minutes, I want to highlight, as I've put out on social media in the last 12 to 18 hours, a really significant policy breakthrough in Massachusetts, where anybody who's been following my reporting knows I got my start covering the 2024 Yes on 4 psychedelic legalization and decriminalization ballot measure that failed in a blaze of scandalous glory and lucrative pocket lining. So the developments in Massachusetts is something that, despite my relocation to DC last fall, I am still actively tracking and in touch with legislative contacts across that state legislature and the grassroots organizations surrounding their kind of regional psychedelic lobby. And news broke late Wednesday night that in an advancement of a key amendment to a prominent state economic omnibus bill was enacted and added to this bill that would establish a 5-year timeline for a state-regulated psychedelic pilot program. Notably, there had been some jostling from a few different prominent state legislators over whether or not this would be a psilocybin only or a broader, all psychedelics, let's keep an open mind kind of a bill. It's worth noting, and as I've stated here on this show and in my reporting before, Massachusetts is one of, kind of the global hubs for the highest quality of research and innovation, massive biotech industry, obviously some of the most heralded research institutions on the planet, Harvard, MIT, even UMass, some of the smaller schools. It is a hub of innovation and a place that surprisingly has not conducted any serious IBM research as far as I'm aware of. And in speaking with a lot of the leading scientific, psychedelic researchers in the Commonwealth of Massachusetts in particular. So major opportunity for IBM innovation and scientific research to get their hands dirty. Private capital, of course, with that very staunch and well-established biotech industry in Massachusetts and across New England is certainly keen. But this pilot program notably includes, as proposed, a number of grassroots advocacy focus points that were key concessions that appear to have been made in a nod to grassroots advocates and a number of state lawmaker allies really having a finger on the pulse of where equity and access fall in the broader kind of scope of priorities for this movement at large and across the country. So not only is there what is being described right now as a medical psychedelic fund that, while vague on details, I have been told the Department of Public Health in Massachusetts is very keen to establish a similar setup as New Mexico's enacted psilocybin treatment equity access fund that's about $500,000 for the first year to cover the cost of psilocybin-assisted treatment for low-income residents in New Mexico. So State Senator Cindy Friedman, who is very influential across both political parties in Massachusetts, but especially when it comes to move the needle issues like this, has been a consistent champion of supporting innovative psychedelic policy reform. And in Massachusetts in particular, and from my understanding, is very, very gung-ho about nailing down the details of equitable access funds for this treatment for low-income Bay State residents. Another key component that I know there's been some chatter on psychedelic Twitter about whether or not this is, just a, fluff and flowers rhetoric move to include this language. But the bill, the proposed pilot program includes language that would exclude psychedelic biotech, like drug developers and pharmaceutical companies, as well as cannabis industry stakeholders from having any financial play or involvement in this pilot program. I don't know that there's as much interest from the Massachusetts cannabis industry or like the cannabis industry at large at wading into the future of like psychedelic assisted therapy. I certainly think that there's probably VCs and donor class folks and, large money investors that have, serious money in both industries and maybe even in joint ventures. But the cannabis industry stakeholder thing, yeah, I can cop to that might have been, kind of more of a rhetoric move to quell concerns from lawmakers that hyper commercialization of psychedelics, which I think is a non-factor as far as public health impacts, as we've seen in other places, and we'll circle back to in talking about Colorado. But that, to me, specifically the cannabis industry stakeholder exclusions, strikes me as a bit more of a rhetorical play in terms of its inclusion. Now, the psychedelic drug developers thing is noteworthy. I know some might say, oh, it's just, to quell grassroots advocates' concerns. The natural psilocybin specific language, natural psychedelic naturally derived psychedelic compound language specifically included in this pilot program proposal is what makes the additional language of wanting to exclude psychedelic drug developers from being involved very noteworthy, considering what's happened in New Jersey, which I've reported on. I would encourage folks to go read my coverage with Psychedelic States of America and Lucid News about the synthetic psilocybin specific tomfoolery that happened in the elbow jostling over the specifics of their supposedly still going to be enacted psilocybin pilot program. And Compass Pathways having an exclusive research contract with New Jersey's Hackensack Meridian Health System is part of my understanding what moved the needle on fast tracking a revised version of the pilot program bill that was friendlier to synthetic and more exclusionary, if you will, of naturally derived psilocybin. So that absolutely plays a role. And also the cultivation and mushroom, kind of mushroom growing and cultivation guidelines that will be enacted and developed by the Department of Public Health are worth keeping an eye on, because this is going to require the Massachusetts to develop an entire internal supply chain for all of it, much like we've seen in Oregon, much like we've seen in Colorado. Very different things are happening in both of those markets on either side of this issue, which we'll get to here very shortly. But that regulatory rollout process has an opportunity to be remarkably innovative in a way that New Mexico kind of radically expanded the opportunities for as their medical psilocybin program has taken shape with real both community and Department of Public Health input in a meaningful and equitable way. But also it's worth noting that Massachusetts is, one of the global leaders in healthcare innovation. So the potential long-term expansion of this pilot program into an actual state-regulated access program for all residents and even non-residents coming in from out of state is a chance to really fine-tune the Wild West legislative frameworks that were enacted, with no prior precedent in both Oregon, and Colorado proceeding. So a lot of info there. And I will note before I move on that I've got a big article digging into some of the complexities and political elbow jostling behind the scenes as this pilot program proposal and amendment has taken shape, including some very curious and particularly scathing former patient and employee reviews involving one Column Health, which is the company formerly run by influential financial stakeholder in the shaping of this pilot program legislation, Colin Beatty, who now runs Control Z Healthcare, a substance abuse clinic mental health care startup in the Commonwealth that has been very pointedly interested in dominating the conversation as to who gets what contracts with the state. And yet, the language included in this proposed program prioritizing nonprofit sites as the preferred contractors through the Department of Public Health to administer this pilot program seems to spell trouble for what, based on the evidence, appears to be Control Z's largely and historically profit-minded intentions for wading into this industry in the first place. Man, that's a whole lot.